Hi there, thanks for joining me back on YouTube. If I'm new to you, my name is Carly. Thanks for being here. I wanted to extend a quick, brief strategy for any of us who are struggling with activation of stress, noticing our anxiety really picking up, which might be pertaining to a specific issue or something that comes seemingly out of nowhere. Right? Sometimes we feel like we don't have control over what our stress levels are doing. This modality, or this practice rather, can also be really helpful if you are someone that does experience anxiety attacks or panic attacks. So I hope it's going to be helpful for you. I learned about this practice, it's called Vergence therapy, when I was in a training for brain spotting, which I could spend a whole other video talking about, and maybe I will someday. But there's also so many places you could find information about that modality, starting possibly with brainspotting.com. It's sort of a sibling modality to EMDR, brain spotting that is. And EMDR might be familiar, and if it's not, that's okay. It stands for eye movement desensitization reprocessing. Both modalities use folks' eyes and where they look to help access the mid parts or the subcortical parts of their brain where memories are stored. So they're beautifully trauma-informed modalities that help folks potentially become more aware of those memories. And then the therapist or the facilitator through those practices can help the client potentially even redefine through reprocessing what those memories mean to them as a way of healing. Really, really brief, reduced synopsis there of what brain spotting can be like. But this practice called Vergence therapy can be a minute or two, and maybe something you use when you notice your own stress or worry belly, like we call it with our kids in my household, starting to uptick. So you might want to use an object like a pen. I even have a nail file here. You could use a nail file. You could use your finger as well. We're going to use the tip of whatever object you choose to look closely at, and then look far away. And I'll talk you through it in just a moment. So this practice is really cool because it again bridges with those modalities of brain spotting and EMDR in that it uses the nerves of your eyes to connect to the base of your brainstem where your vagus nerve starts. And if you've heard of polyvagal theory, which is Stephen Porges' work, Deb Dana's work, you might know that the vagus nerve comes down into two branches, and both branches have access to our sympathetic nervous system and our parasympathetic nervous system. This strategy of Vergence therapy helps access the parasympathetic part of our nervous system to calm and to ground. So we're going to use that now. So if there were a specific issue, I'm trying to think of one offhand. Let's say there was like a speech I was going to present, and I was having a lot of anxiety about giving this speech to a large group of people. I might use this right before I go on stage to help bring my whole nervous system into a steadier, maybe more balanced place. So what you do is you find your object, again, your pen or your nail file or your finger, and you place it about 8 to 12 inches in front of your face. And mine might be a little closer since I'm closer to the camera, but if you have your object, again, about eye level and about 8 to 12 inches in front of your face, you're going to look at the tip of this object, your pen, maybe your finger, whatever it is. And you're going to focus on that, bringing your eyes to that point, and you're going to breathe however you need to breathe. Allow your body's wisdom to guide your breath there. And you'll take a few rounds of breath, and then you're going to look kind of through, so to speak, through your object to the object or the wall behind you. I have a wall that's about 6 feet ahead of me. Maybe you're outside and it's a tree, but you're looking through the object, in which case now your eyes, you might notice, play a little trick on you. It's like I see two pens because I'm looking kind of through the object. Right? You breathe there for a few minutes. And then after a few breaths, and then you're going to bring your focus back to the tip of the pen or whatever object you have in front of your face. And then back to the wall or whatever is behind it. and then back to the tip of the object, and so on and so forth. I'm going to lower my pen and come back to the screen. So you're bringing your focus close and then a little bit further away for maybe a minute, maybe two, if you feel like you have that tolerance for it. I already noticed, I feel like my speech is a little slower, and I am pretty aware of my heart rhythms, and so I can feel like my heart beating is a little slower, right? My heartbeat. I thought there was another word there for some reason. So check it out. See if this is of interest for you to try. I find it really helpful sometimes when folks come in who I work with and they're activated right out the gate. We might start with this. It's really like a mindfulness exercise, and it feels very accessible for a lot of folks. I would implore you not to do this while you're driving. I could have made that disclaimer first. Don't do this while you're moving. Find a seat. It can be very brief, 30 seconds, or you could do it for a couple of minutes, whatever you need, and see what it's like to come back into balance a little in your nervous system. I hope that's helpful, and I hope to hear from you if you have any feedback or experiences with it that you want to share. And otherwise, take care and talk to you soon.